My name's Marsha McAdam. I'm a physical and mental health advocate and a lived experience member from the Equally Well campaign. And I'm with...
Yeah, my name's Kevin James, also known as Co-Production Norfolk, and I work as a mental health and social care peer consultant. So I work with organisations and services, providing them peer support around shaping and developing services here in Norfolk and Waveney. I'm also the current chair of the Expert by Experience Working Group for Equally Well UK, which is a collaboration between the Centre for Mental Health, Rethink UK and the Royal Colleges, and about 50 other organisations as well.
I guess we're having this conversation today to talk about the good and the bads of mental health and social care that we both experienced. How's your experiences been over the last few years?
It's been really tough trying to get a coordinated, holistic approach to what are my complex comorbid conditions. So many of us that have severe mental illness will be managing, up to 4 other complex health conditions alongside that. So, physical health conditions alongside quite a complex psychiatric diagnosis. And as a result of that, it's really difficult, I've found, to get all of the professionals in one room together to have a joined up conversation about what best meets my needs in respect of meeting the needs of my complex comorbid conditions. So, I suffer with type 2 bipolar, complex childhood PTSD, social anxiety, acute social phobia and agoraphobia. So I've always had a need for domiciliary type care. So I've always had the need for someone to come into my home to help with tasks of daily living, so helping me with my personal care, helping me with my food, shopping and personal shopping, like clothing and toiletries and stuff. But I've also needed a significant amount of support around being able to access socially inclusive activities. So I love going to, pre-COVID, I loved going to the cinema. Football is a massive part of my life. I've got 4 season tickets for Norwich City Football Club, which my friends and I share. That's an important part of both my recovery and social inclusion. And what I've struggled with is being able to recruit personal assistants into posts that really understand people's complexities of comorbidity. And I think, paying people minimum wage doesn't necessarily allow us as people with experienced service users, forgive me if people don't like being referred to as service users, but people with experience who have those needs, it's really difficult to recruit the right people with the right skills into post for minimum wage. And it's really difficult to find people that can only work for, maybe 10, 15, 20 hours a week. But I have to say, my experience of my social care needs being met over the last few years hasn't been good for me. And I think maybe some of that is about caseloads, about how many people that social workers and mental health teams have on their books at the time. I've got an outstanding personal assistant who I've hired on and off for a number of years, who I have to say came and worked for me just to fill in a gap, sort of autumn 2019, just before COVID hit, and has been with me all the way through COVID, and has been absolutely, has been an absolute rock in respect of doing my food shopping, my meal preparations, making sure that I've got good, well-balanced, healthy meals in my freezer. I wouldn't have got through COVID without her.
Can I have one of her?
Yeah, if I could clone a Louise, I absolutely would. She's amazing. She has no formal training around mental health. She's no formal training around learning difficulties. You know, I'm Aspergic as well, but she is just such a calming, soothing presence and influence on my life. Her ability to de-escalate situations by using humour is amazing, and we need more Louises out there for us.
So, you know a bit about my story in the past.
Yeah.
So I need domiciliary care for personal care, food preparation, give my medication. And a few years ago, I went through some really traumatic times and went through 4 care agencies in a space of 2 years, and then ended up wanting to die over 1 year. I remember being in crisis point over 3 stays because I just didn't want to live. I was placed under the complex care team, and it was only supposed to be for 12 weeks, and almost 2 years later they're still with me. And a lot of it's down to COVID, because a new agency should have been put in place, but then COVID happened. And it's only through the stability of that care, you know, the carers coming through the door, the named carers, that sort of kept me well. And I refer to them as my fairy godmothers, similar to what you may feel about your PA. They sprinkle the fairy dust on me, and it then means that I can do this. If I had a magic wand, right, what I would want is to have like 3 or 4 personal assistants, that almost like a pool. So like where 2 of them can work 8 hours each, and then, but that's not non-existent really, those type of things, are they, Kevin?
I think one of the things that Norfolk and Waveney have done, so Norfolk County Council, after many years of what has felt like a very adversarial relationship with the county council as people with disabilities, and having honest debate and conversations about how best to meet our needs. You know, I've always said, you know, why is the county council not delivering training to personal assistants around sort of mental health first aid or de-escalation techniques or whatever it might be? And there has been a move in Norfolk to have a PA register, because we were saying for years we need a bank of personal assistants that we can approach and that we can hire, because quite often, you know, we can't find one person with all the skills that we need that can work for just 10, 15, 20 hours a week. You know, so we need to be able to separate those roles and responsibilities out. So I need a lot of help and support accessing volunteering. You know, I've got a very severe form of dyslexia called Mears-Erland syndrome, which means I need help and support around reading and writing and accessing technology and all of those other things. So finding someone that can do the domiciliary care stuff, can help you with social inclusion and support you with accessing education, work, volunteering, whatever it might be, is a tall order. And, you know, so, and also my experience of bringing in agency care hasn't been particularly good. You know, you might be able to get your shifts covered, but again, you know, what we really need is we're building therapeutic relationships with our personal assistants. And also what I really struggled with was when the Care Act came in, that a lot of county councils chose to stop paying for socially inclusive activities. So they stopped paying for things like gym memberships, they stopped paying for things like season tickets. You know, and when you think about something like a season ticket for football, so it's about £500 a year. When you think about what you're getting in return for that, so through the whole year, apart from a couple of months in the summer when footballers go off and have their summer holidays, you're socially included, you're socially engaged, you're doing something pretty much week in and week out that piques your interest. You're part of a community. You know, you've got the ups and the downs and all of the rest of it, and VAR and all, but for £500 a year, I think what you get back in return is a significant return around positive mental health and well-being. So you know, I know that county councils will pay for someone to support you to access an activity, but not the activity. So I think that needs kind of looking at as well.
For me, I'm waiting to get a care agency that deals with both my physical and my mental health, and they're like gold dust, really. Or is that the right word? They're just non-existent, and that is what fell down years ago, was because that wasn't there. And so my really bugbear is, how can people commission services to support someone with physical and mental health, yet they're not really equipped to deal with that? And then that means that I don't get kept well, and it doesn't improve my quality of my life.
I know that when you're assessed for a personal budget, support plan and stuff, you can ask for an occupational therapist from a physical health team to be part of that assessment. But you know, one of the things that really bugs me is the financial assessment part of a personal budget. Why not do the financial assessment part first before you do the support plan, write the budget, and then put it before a manager or panel? Because I know so many people with lived experience who qualify for a personal budget, go through all of that really anxiety-provoking stuff about having to tell your story, going into absolute minutiae and detail about your personal care needs, which is just so embarrassing. And then once you've done all of that, they go away and do a financial assessment and come back and say, you know, you need to pay £90 a week out of your income, which might be benefits related. And it's kind of like, so many people go, I just can't, you know, you're allocated maybe 15 hours a week and you're asking me to pay £90 towards it. I can't possibly do that. I'm on a low income. So there's ways and means that we can look at that can really improve the process and make it more, you know, just make it more friendly. And also something that you and I are really passionate about is the co-production element. So if they are commissioning services, if they are looking at redesigning services, if they are thinking about creating a personal assistant register or a bank, and also thinking about some training alongside it, then we should be involved in that from the very outset as people with lived experience.
Before we go, I wish that there should be lived experience people on the panels that are making these decisions. I mean, one of the things that I have is fibromyalgia, chronic fatigue, type 2 diabetes, borderline personality disorder and stuff. And it's not really joyous in that, is it really? And for me to have a personal assistant like I did years ago, I wasn't in the right frame of mind or to actually manage a budget. You know, someone's paying someone and everything like that. And so I just think that if this is happening to us and we have voices, what's happening to people out there that don't know?
I you know, so advocacy is really important in all of this. You know, understanding whoever has the information and advocacy and support contract wherever you live, it's really important to find it out. But something that I hadn't thought about, which is an amazing idea that you've suggested, is having people with lived experience on the panels.
What would you like people from watching this video to take away with them?
That there is advocacy out there is really important. So identify what advocacy support is in your local area. Try and link in with a support group of people with disabilities. Quite often there are some kind of community interest companies or voluntary organisations that support people around personalisation. And, you know, be bold. you know, quite often so many of us don't want to admit that we need personal care, that we need intimate care, that we need those kind of things. Please just, you know, just be honest about your needs. And if you're not happy, then you do need to complain, because that's how people learn, through the complaints process.
That was more than one.
Sorry, you know me.
My one is, surely services should be commissioned that would help my quality of life, which is having the physical and mental health actually recognised and me treated as a whole.
Yeah.
Because those services aren't out there, and they should be. Why just have a small in-house group that are like fairy godmothers? But it's just sort of heartbreaking. I'm going to get off my high horse now. And thank you for recording this with me.
Thank you for inviting me. It's been an absolute pleasure.